Hello, Seagulls. It's Thursday, September 30th. Thank you for joining us. Yesterday, with our partners from the Wicomico County Health Department, we held our second on-campus COVID vaccination clinic of the semester, at which many students and employees received their second shots of the Pfizer and Moderna vaccines. Though they will need to continue twice-weekly testing to maintain campus access until they're considered fully vaccinated 2 weeks from now, the diligence of these and other campus community members has put SU in a really good position as far as vaccination rates. As of today, 93% of students and 95% of employees on campus are at least partially vaccinated. By mid-October, those percentages will represent our fully vaccinated population. The students and employees who have received the SU exemptions from the University System of Maryland vaccination mandate will continue twice-weekly testing for the remainder of the semester. These high vaccination rates, the availability of free testing for all students and employees, and required twice-weekly testing for those with exemptions, along with our in-house contact tracing infrastructure and robust safety protocols, have kept our positivity rates around or below 1%. SU is one of the safest places in Maryland when it comes to COVID-19. Now, our campus vaccination rate is higher than every Maryland county, as well as the state as a whole. Thank you to all students, faculty, and staff who have committed to keeping our campus as safe as possible. Because of your commitment, we've been able to close out our first month of full operations since the pandemic began with a very high sense of normalcy. We've had fans at Sea Gull Stadium and other athletic venues to cheer on our student athletes, and we've been able to hold events on campus for our students and for members of the community. Most importantly, we've been able to hold in-person instruction safely. Other great things are happening on campus as well. Next Thursday evening, October 7th, the Center for Equity, Justice, and Inclusion will host an open house for the community, providing campus neighbors and others with the opportunity to explore the recently remodeled facility and to connect with its 7 resource centers, including the African Diaspora Center, the African Asian Pacific Islander Center, the American Sign Language Zone, the Disability Resource Center, the Latinx Center, the LGBTQIA+ Resource Center, and the Women's Center. An open house for the campus community will follow on the afternoon of October 8th. And please note that the next day, Saturday, October 9th, marks the return of our Sea Gull Century bicycle ride, in person for its 33rd year. If you're driving near campus or out in the community that day, please watch out for cyclists. We're excited to welcome some 4,000 riders to campus this year for what historically has been Wicomico County's largest annual one-day tourism event. As always, thanks to all members of our SU community for continuing to do their part to protect the flock. I'm now going to turn the briefing over to Eli Maudlin, SU's Chief of Staff and our COVID-19 Response Coordinator, for questions. Remember, send your question to stayinformed@salisbury.edu. Eli, take it away.
Thanks, Dr. Wight. The first question is regarding the take-home tests that are available at the Agrarian Student Union info desk. And this person wants to know if the tests are reported on our dashboard. At this time, the dashboard reflects the tests that are administered on campus in the Great Hall of Holloway Hall. And that is because that is how those tests are reported to the county. We have a separate reporting mechanism to the county for the at-home tests because they are self-administered. So they are not reflected in the dashboard data. Those numbers are very low as well. This next question is related to accommodations for students who contract COVID-19. What options do they have? So if students are medically not cleared for class, they should first, of course, make sure they contact campus health to make sure that campus health is aware of their situation so that they can properly be coded in their faculty member or instructor's rosters. At that point, the student should also reach out to their faculty member or instructor to make accommodations or arrangements for missed coursework as it relates to them being in quarantine or isolation. This question is related to close contact. How does SU define a close contact? So close contacts are determined through a contact tracing process that's done by a nurse in campus health, and they come up with those parameters through guidance from the university's health team and following guidelines from local, state, and federal health officials. But close contacts are really determined on a case-by-case basis after a nurse in campus health does an investigation of the situation. This person is saying that they had their Pfizer vaccine over 6 months ago. How do they go about scheduling a booster shot on campus? So yesterday's clinic was done by the Wicomico County Health Department, but Salisbury University through Campus Health does offer the COVID-19 vaccine. We are currently working on getting the Pfizer vaccine. Traditionally, we've only offered J&J on campus. Once Campus Health has that vaccine and the boosters are available on campus, we will communicate that to members of the campus community. This person is asking about a N95 or KN95 mask. How do you go about getting them? So you can use the same appointment system that you use to schedule testing. That's TimeTap, which can be found on the SU website, or you can simply send an email to Campus Health and they will help you set up that appointment. And this is a question about telework in January 2022. I think that, for telework policies and things like that for next year, you should stay tuned and talk to your supervisor and look for communications from human resources. That does it for the questions for today. Thank you.